We're gonna.
Yeah, we'll give it another. Just as soon as I see somebody jump in, we'll go ahead and start.
We're gonna try to shoot for like an hour and a half, something, whatever.
Yeah, whatever, however it goes. I mean,
yeah,
we'll go for questions and things like that. All right, we'll go ahead and start. For you guys that are just jumping in, I'm Jason, Colorado Mountain Man Survival, Donny Dust, Paleo Tracks. We're gonna probably run for about an hour, maybe an hour and a half here. Just a little disclaimer. Donny and I are not doctors. We're not your doctors. We're not medical directors. We're first responders. So we're going to give you the information that we know and what we use and what we do. Nothing that we tell you is going to replace what a doctor has told you or should supersede any of your training. So if you're not trained to do something that we're telling you to do, either don't do it, go get trained, or do whatever we tell you at your own risk. Now that we've got that out of the way, we'll go ahead and let you get going, Donny. As we're going, I'm gonna be dropping some links into here to try to keep up with some of the stuff Donny's talking about. If you're interested in some of the gear that we use, I'm gonna try to throw out some links out there so you guys can go check the stuff out. But anyways, I'll turn it over to you for now, Donny.
Right on. Yeah, absolutely. So Jason and I were talking, and some of the ideas that we were kind of rolling around in our head, discussing some of the specifics about some of these little live streams, was kind of focused around some medical practices, first aid, wilderness first responders type stuff. And it was important for us to kind of lay down kind of some of the options that are out there, some of our practices, some of our best practices, and then some of the resources we use, because as guides out in the mountains, when you're teaching skills, it's very important to have a wide covering of emergencies that could actually take place. So let me just paint a real quick scenario for you. And this actually happened to me this past Sunday. I was driving through the mountains, and I was coming around a bend, and I had seen the tail end of an accident where this young girl from Colorado Springs, who was a student, had just flipped her car 4 times. And the right side was completely smashed in. She was in the process of getting out of her car when I jumped out of my truck, and I ran over there and kind of went into that mode that some of us are familiar with, where, is everything okay? What's your name? Tell me what happened. You're checking for a lot of different things, but miraculously, there's just a few little bruises and scratches on this girl, but she had her head down, going around a turn, possibly texting, and she rolled her car 4 times. And that could have been a completely different scenario when I came around the corner. That car could have been flipped over 4 times, landed on its roof, and her body could have been sticking out with just a few signs of life left in her. Fortunately for me, and much like Jason, we've learned various things, whether it's been in the military, civilian lives, as guides, as instructors, to be prepared for these sort of things. And in my car that day, I actually had my full medical kit. Now, my medical kit, this one right here, which is in a just a waterproof bag with a little tourniquet on the outside. This is the same bag that I utilize if I'm working on a movie set. And as a set medic on a movie set, it requires a lot of different things. It requires you to be able to triage something very quick, like a cut, as well as medevac a person for any sort of serious injury, whether it's a fall, whether it's an accident, whether it's some sort of bite. So you really have to cover a lot of things. And that was kind of the idea that Jason and I wanted to do during this little live stream here, is kind of cover those different environments and the gear, the medical gear that we employ in those environments, to make sure that our clients, our family, and civilians out on the street are well prepared and kind of know that we have those abilities to provide that medical service, and it gives us peace of mind that we can do so. So that's going to be kind of the general flow for today. And as you guys have questions, feel free to chime in. And like Jason said, I'm not a doctor. My medical training and background goes from the age of really 19 years old all the way up until current day when I'm 40. And that has been all sorts of military specific medical training. My time in the search and rescue out in San Bernardino County, California, all sorts of medical training there. And then as a guide out here, between CPR, AED, your Wolfer, your basic first aid. All of these things are really just knowledge, skills, and abilities that I've maintained over the years. And it's given me different opportunities from, helping people out in the natural environment to working on movie sets to triaging my own kids. And also, feeling confident of jumping out of my car and trying to help somebody in the time of need. So I guess what we'll kind of do as we go through this, you guys have questions, feel free to fire away. And I won't go into a lot of details into like every specific thing, but I will go over some key points so you guys can kind of understand what's in my home first aid kits, my guiding kits that I guide clients with out in the backcountry, as well as something that I would employ on a movie set as a set medic, maybe taking care of 100 plus, actors and actresses, as well as an entire production and crew. So we'll kick it off with.
Well, before you get going real quick,
Yeah.
let me say something.
Yeah.
For any of you guys that are asking questions on here, I will not see your questions unless you go to the Colorado Mountain Man Survival Facebook page or through the Colorado Mountain Man Survival YouTube page. So if you're on any other page and you're watching this broadcast from where I shared it, from that share, I'm not going to be able to see your questions. So come on over to Colorado Mountain Man Survival, ask your questions there if you have any, and then I'll be able to see them on the screen here in front of me. Otherwise, I'd have to search over the internet, and that's just not going to happen. All right, go ahead, Donny.
Yeah, no worries. So for my home first aid, I essentially just have a first aid box. And why this box exists is really it's for my kids, and it's for myself and anybody that can need something. But it's a box that they can all go to. They can get inside and apply a bandage, whether it's a cut, a scrape, they pick a scab, whatever. The resources in here are just going to kind of help them out with that. It's really designed to triage those accidents at home. And I always like to think, what are those accidents at home? And the accidents at home can be all manner of things, from burns to electrical shock to cuts, scrapes, falls, so on and so forth. But you have to really base that off of what I would call your pattern of life. Your pattern of life dictates certain actions and outcomes. So if you are in a house and you are constantly working with, woodworking tools, or you're welding metal, and you're doing things that are more prone to injury, your first aid kit at home might have some different contents in there. You could have more, maybe burn gels if you're welding. So I'm a flint napper, right? I was going to provide Jason some of my gory photos of stitches and complete removal of flesh, but I didn't want to do it. But, as a flint napper, most of my injuries are cuts, deep lacerations, deep incision. So difference between a laceration and incision. Incision, it's a smooth cut, will close nicely. Laceration is very jagged. And most of the stone that I work with will typically incise, but there's times where it just kind of rips the flesh open. So in my first aid kit, I have things that address those sort of immediate wounds. Bandages, quick clots, burn ointments for anything I might, because, you practice a little hand drill and you're blowing into your tinder bundle a little bit and maybe you burn your hands. But your home first aid kit really needs to resemble your pattern of life at home. If you're a big time cook and you're always cooking, burns are more likely. If you're doing a lot of athletics outside, whether you're shooting hoops or playing baseball or basketball, more things along the line of a twist or slight muscular sprains might be something you might come across. So take your medical stuff at home and build it off your pattern of life. Some things that I don't have inside my in-home kit are suture kits. That's in a different bag. Some things I don't have in here are the face coverings for conducting CPR. That's in my triage bag for our backcountry clients and sets. So again, I keep it pretty simple. And more importantly, I want to make it comfortable enough for my kids to be able to go in there, pull out a Band-Aid, apply some Neosporin, and move on with their day. So first home kits, not going into too much. Burn gels, big box of burn gels, lots of Band-Aids, Q-tips, tweezers. Dad, I got a splinter. I've got a thorn. I've got something in my foot. All sorts of Band-Aids is really the biggest one here. Band-Aids, different sort of cleaning gels as far as Neosporins, topical ointments, Purells, Clear Eyes. They get stuff in their eyes. We get allergy seasons. These things are very easy to treat and kind of put together. What I do is I create a non-complex kit. It's going to allow anyone in the house to grab it, put it into action, and ultimately use it. some things that I do keep in here are just low grade medications, something like aspirin 81. Why do I keep this in here? Well, as a heart attack survivor, the aspirin 81 milligrams aspirin is something that I have. So I have multiple bottles of aspirin spread throughout my house just in case I ever start having signs and symptoms of a heart attack. Aspirin, baby aspirin is one of those things you definitely want to shove down that person's throat, dilate their vessels, and get that blood moving. So in-home kits, nothing too crazy. What I recommend is there's lots of resources online where you can find already made kits. Those are great ways to start off. Jason will probably provide some of those links. But the idea is to really kind of take a look at your life and say, yeah, we cook a lot. We're always out doing sports and athletics. So maybe we're doing sports and athletics. I need more ACE bandages and I need some ice compacts in case there is a twist or a pull, or they trip and fall as they're playing basketball and they've got more of a scrape. And I've got to get some iodine and a light scrub to scrub out any of the material that could be on the inside. So at home, certain requirements based off your pattern of life. Now, the important thing to remember with a first aid kit at home is you got to know how to use it. So if you incorporate a lot of stuff in there and it's very technical to use, requires a certain level of training or a certain level of know-how. What you don't want to do is have something in there that's too complex, and in that time of stress, you don't know how to use it, or maybe somebody else doesn't know how to use it. So kind of keep it simple, keep it very approachable, and then really just educate your kids, your spouse, your loved one, significant other, and the kind of the things that are in here and how you go about using it. Jason, you want to add something?
No, I was just saying that what you brought there or showed there looked like a really big first aid kit that you get from Walmart. I mean, you probably have some extra stuff in there too, but a lot of people ask me about what kind of first aid kit that they should carry in their car in the backcountry with them. What you just showed is definitely not something you're going to carry away from home. I carry that. That's a basic first aid kit, more of a boo-boo kit, really. That's not what I like to call a trauma kit. And usually when I'm out in the woods, I'm carrying what I call a trauma kit. It's something for big problems. I typically in my trauma kit, I might carry a few Band-Aids, 5 or 6 of them, especially if I have kids in the group with me, because that's more of a comfort item. You know, kids get those little cuts or nicks or splinters, and just small kids putting that Band-Aid on them makes them feel a little bit better. Now, if you're doing flint napping or you're doing a lot of knife work, you know, those Band-Aids definitely do hurt or help. Keeps us from bleeding all over the place. Yeah. But that is a very basic kit and not your trauma kit. But other than that, I think you've pretty much gone through everything for your basic first aid kit, which is a great thing to have. It's just not a life-saving kit.
No, what these are your life-saving kits. These are two bags that I always carry with me. I have 2 distinct colors. I got my red carrier pack. This is the one I always have on my person. Now, I typically use these on different sort of TV and film productions. I have a red one, and I have this yellow one right here.
Real quick, Donnie, we got a question regarding cuts. So, what's your feeling on super glue on cuts?
Yeah, super glue is definitely a great option. You can use super glue in a pinch. There are some medical grade glues that work really well to close small wounds. But you really have to think of yourself in a couple different ways. If I've got a cut and that cut is deep and I'm already questioning, will I be able to get this closed? You might need to go to some sort of medical professional. In a pinch, it's a great option. A lot of people run the risk of closing that wound up with something on the inside. And that's where you start running into problems. So a thorough cleaning of the wound and then incorporating a super glue is really your best option, because you get a cut, there's any sort of debris on the inside, it's going to fester, you're going to get some gangrene, and you're going to pose a problem. So if it's really deep and you're unsure on how to clean it out or scrub it out, definitely get yourself to a doctor and take the necessary steps. But it is an option. I definitely recommend the medical grade stuff. But
yeah, if it's not medical grade, isn't it necrotic? Is that the right word? It'll actually eat or damage your skin.
Yeah, you'll get necrosis of the skin. And that's for like a deep wound, because that deep wound is already, between the several layers, all the dermal layers, you're down deep. But if it's just something kind of topical and you can stop the bleeding relatively soon, if you have a cut and you apply pressure to it and you're having a hard time stopping the bleeding. And once you do stop that bleeding, you apply some sort of super glue to it. It might be the wrong sort of super glue. That's where that medical grade stuff would really come into play. I have some of that in my kits just for that reason, where, you know, I think I don't want to call it a myth, but the super glue, you know, idea is this is all I have at home. It's a little bit deeper than a Band-Aid. I don't know how to apply stitches, so I will squeeze it together and apply that little layer of glue on the top. It will close the wound without a doubt, but you might run the risk of future infections and necrosis of the skin as well.
Yeah, and Stephen just said lots of wound irrigation is very important, especially in the back country. Absolutely. If you're not carrying a syringe, a lot of us backcountry people these days carry the Sawyer water filters. These things that come with them to back flush your water filter. You can use these guys to also irrigate your wound in a pinch. If you don't have that, then you can actually use a sandwich bag or something and poke a little hole in it and use that sandwich bag to irrigate your wounds.
Yeah, wound irrigation, that's going to be, there's far too many times people will not irrigate a wound properly. They'll leave some debris on the inside, and just all number of problems will start to play out. And it's funny about, God, it was probably about 10 years ago, I was climbing Mount Whitney with a gentleman, and we were coming down the mountain, and we were the first one up that season. We were coming down. We had some crampons on. We were walking close to a creek. He started to slide in the creek. I grabbed him, and I put a crampon spike through the back of my leg. And when I put that spike in the back of my leg, it went right through my pants. And as I got up and saw plenty of blood kind of here, there, and everywhere, I immediately went to my pants, and I wanted to see and make sure that the outline, that cut that was in my pants, was complete. Was it a rip? Was it a puncture? And what wound up happening was there was just a few little threads that were pushed inside my wound. And, you know, there I was face down, and he was pulling out these little threads with a pair of tweezers to ensure that I got all that material out of that wound. And that was a pretty gnarly one, because it was right on the back of my leg where the fold is, and it bled for a good time. But yeah, irrigate the wounds, otherwise future problems.
That probably felt pretty good too, didn't it?
Yeah, I won't go into the full story, but there was a certain point I wanted to push him off the top of Whitney.
Right.
But
yeah, whoever you're treating, that you're irrigating that wound, they're going to hate you in the moment, but really it's got to be done.
Yeah. And, you know, some of the things that I have, and these can be hard to come across, are just straight IV bags. The saline in some of these IV bags are great ways to irrigate wounds. Clean water, ideally. Saline, yes. Iodine. There's different formulas, different concoctions that you can use. And having just pre-made little vials, if you will, with squeezer tops on it, in the event of some sort of major issue where you do have to irrigate a wound, you have those resources, you know, go through it. And that's kind of like, were you saying?
I was going to say something, you know, everybody always asks me about the water purifying chemicals, the iodine to go in your drinking water. I hate that stuff. I don't use that to purify it, but I carry some for this purpose. You know, you can put those iodine water purification tablets in your water and then use that stuff to irrigate wounds.
Absolutely. You know it's clean then.
Right. Yeah. I mean, still
Gerardia from a from a paper cut. But yeah, so when it comes to really doing anything outside of my house, if I'm traveling to a movie set or I'm going to be running any classes, I carry these two bags with me. And these bags are two purposes right off the bat. Number one, this is the one I will carry on my person, whether I'm going into the backcountry or I'm going to be walking around a set dealing with any number of problems. And this bag is my sustainments bag. So this bag is supported by this bag. Why they're two different colors? This is on my person, and I do a safety brief right up front. I say there's one red bag on set. It's the medical bag. There's one sustainment bag for extreme situations, and it's yellow. And it's marked with that international cross of like, hey, this is a medical bag. So I can tell anybody on a set, they all know where it's at, go get the yellow bag, and they know exactly where it is. It's the only yellow bag on set. Same thing with the red bag. 90% of the time, it's on my person. Now, to complement these two bags, I also carry a chest rig. And my chest rig is just kind of that immediate thing. And on the chest rig, I have basic Leatherman light. I have a small first aid kit. And this is really just to treat majority of the major issues that you could come across. And those are typically cuts. Neosporin, Band-Aids. and some ibuprofen, something to that extent. That goes inside here. On the inside, I have a medical logbook that I write down any medical issues that could have taken place. You got to keep track of that so you can follow up on all the different patients. And when I mean patients, somebody with a small cut or a small abrasion needs to have that follow up, especially if you're kind of doing remote things, because infection and a whole number of things can rise up, as well as any sort of maps that support any medevac locations, and a radio. Jason and I were talking about radios earlier. There's a whole variety of radios out there. These are actually radios that can tap into fire and medical services. They reach out, they got the right megahertz with the right operating licenses. These are the great things to have. You have a couple of these, you designate these as emergency radios. There's no other chatter going on. You can give these to your counterparts if there's other medical personnel serving with you, and away you go. So this is kind of a macro on some of the medical stuff, but on my standard medical bag, one of the things that I have in there are IVs, and I have a heart rate monitor. All right, I have they call it oximeter. I have a pulsometer.
Oh, Donnie, I don't know if you can hear me.
That was my sister trying to give me a call.
Oh, I blocked out.
And these are the things that you are going to do your initial vitals with for a lot of different patients. So if someone is coming to me saying, I'm not feeling well, and we start kind of going down a list of questions, and I can figure out what that problem is, I'm going to do their blood pressure. I'm going to take their pulse. I'm going to get their oxygen levels, and we're going to do some follow-up questionnaires to kind of get an assessment on why it is they're feeling this way. It will give me the opportunity to triage that person and say, all right, clearly you're dehydrated. We need to rehydrate for the next couple hours. Let's do a urine check. Let's do a pulse check. Let's go through all those necessary steps. So keeping a blood pressure cuff, an oximeter is extremely important on there as well. On the inside of this guy, it is waterproof, and I have a couple different bags, and my bags are kind of separated by colors. Colors serve different things. I have a variety of tools. One thing that's very important, and a lot of folks probably won't have this. The reason being is I have with some of the medical training I have the ability to administer some of these things. This right here is adrenaline, and this is for any of those accounts or those events when somebody could be going into an anaphylactic shock and they need to be administered some adrenaline. So most people are very familiar with epinephrine, the EpiPen. This is 100% straight adrenaline based on the patient's age, their overall size. This will help me, their throat starts closing because they've been stung by a bee or they've been bit by something. I can administer this. So I carry adrenaline, epinephrine.
Let me just type in there real quick, Donnie.
Face covering for CPR for a patient. Let's see.
Can you hear me, Donnie?
Inside. I have a couple tourniquets. I got one on the outside of the bag, one on the inside of the bag, and then one of my most favorite things in the world, the snake bite kit, the bee sting kit. Now, let me tell you why so many people do not like this. And let me tell you why this is probably one of the most important things you can have in your kit in the backcountry. If you've ever come across a patient who's been bit by a snake, the one thing that is going to draw them and increase their heart rate and cause all sorts of problems is telling them that you have nothing to help them. All this is a psychological advantage. I can put the little suction cup over their wound. I can use a variety of things on here. I can apply it to them and say, it's going to be okay. By me doing something, I'm going to bring that heart rate down. I'm going to put them in a much more kind of relaxed state. They know something has happened as we start to medevac them out. But actions have been taken for their well-being. That is a huge step. As someone who's employing medical skills, you got to come up with something to get them in a cool, kind of calm state of mind. And one of these bite and sting kits, they're very ineffective. They will not draw out venom. You might draw out some topical moisture based from that skin, but you're not drawing out venom. But what this does, it gives them that psychological advantage. It can really help in that lowering of the heart rate and ultimately keeping that person in a nice, calm state of being. So it's kind of funky because they really don't work in the physical form, but they work very much in the mental form. Thermometers for you can't hear me for some reason, I don't think.
Yeah, can you hear me? Yeah, you can't. Can you hear me? I can hear you.
You can't hear me. Thumbs up, you can hear me. Okay, cool. Another thing, but yeah, just keep texting. You want to yeah, this is why we belong in the woods. So the other thing I have is a thermometer. It's always important when you're taking temperatures. And typically I carry two. And anyone that carries two thermometers, you could probably wonder why. Not really if one breaks. One goes in the mouth, one goes in the rectum. In the event that you have a heat casualty and need to do a body core temp, and through the rectum is the best way to get that. So you just got to make sure you don't mix them up. That's the number one thing. Don't mix up the rectal thermometer with the the oral thermometer. But if you don't have a patient that's cooperating, you can kind of mix them up in your hands and be like, which one? And then tourniquets. Those are always important as well. Let's see what other stuff we got in here. Yeah, here we go. All right. Inside here. So that's my blue bag. My blue bag is pretty much all of those big macro things that really require a little bit more effort. Tourniquets, CPR covering, so on and so forth. Inside here, the red bag is kind of the blood bag. That requires the medical. This is where I have my quick clots, my Band-Aids. I have iodine. I have various things that are going to deal with cuts, major lacerations, punctures. So there's a couple different types of wounds. You ever heard the word of crush, laceration, incision, and puncture? So, you have different things, including abrasion. So you could call the acronym CALIP, crush, abrasion, laceration, incision, and puncture. Your kit should be able to address the CALIP concept. So a crush, so bone is completely crushed and you have maybe some external bone sticking out. An abrasion is like a scrape. Laceration is a jagged cut. Incision is nice and clean, and a puncture is essentially a puncture wound. So your first aid kit, maybe you carry with you in the backcountry or you're guiding or just even hiking, should be able to address the CALIP concept. So the crush, abrasion, laceration, incision, and puncture. In my red bag, in my big medical triage bag, is that bag that addresses all of those needs, because those are very common. I mean, just the other day I was out in the mountains walking around in a loincloth, and I took a branch right across the side of my chest, and it gave me a good little scrub. I washed it out with some snow, threw some Mousse on it, and kind of went on with the day. But it is something definitely you need to consider. And then I have my orange bag. My orange bag, which is this guy right here. So I have my blue bag, I have my red bag, my orange bag. These are all my bandagings, my tapes, things to that extent. They're going to give me the ability to, protect the wound. So I have ACE bandages on there. I have a variety of splints. And what these do, they give me just an idea that I know how to now treat the wound through my blue bag, my red bag. Now I have different opportunities to protect that wound, whatever it might be, or whatever that injury might be, through my orange bag. Now, the reason why I have these different colored bags is because you might designate somebody in your group or in that party as you're going through all these steps to say, hey, go inside my big red bag, hand me the blue bag while you're holding pressure on a wound. You have some colors that you can designate people and bring them to. If I had a bag with all these different things and just kind of chaos and pouches and pockets and stuff, it'd be a little bit confusing, because if you're kind of a lone person out there, you might need to say, hey, go grab me my blue bag out of the big red bag, and you'll be able to figure out. You do these in briefs and everything, but it works out.
Can you hear me yet, Donnie?
Yeah, I can got you now.
All right,
Can
cool.
you hear me?
Yep.
Cool.
I just had to leave and come back in. I was worried I was going to shut the whole thing down.
No problem. And then on some of these, I have some instant cold packs. If you are remote, typically a nice cold compress will help reduce swelling. So I carry some cold packs in that kind of my macro trauma kit. Now, this kit is supported and supplemented out of my yellow bag. So they work interchangeably based off, again, that pattern of life where I'm at. So if I'm bringing 5 clients into the backcountry, I've done a medical assessment, medical questionnaire, I know some things about them, and I will take my red bag and I will have it reflect the most likely or the most dangerous course of action, the most probable course of action, the things that can actually happen out there. So if I know we're going to be walking through some kind of remote backcountry stuff, there's some rocks and there's an opportunity to slip and fall, twists, I'm going to bring some more ACE bandages and some cold compacts. If we're going to be doing a lot of knife work and stone work, I'm going to bring some kind of medical equipment to address possible lacerations as well as incisions. So my red bag greatly reflects what I'm going to be doing, whether it's a movie set, whether it's guiding in the backcountry, whatever the case may be. Some of the sustainment items that I always have in my yellow is this is a litter. This is a soft litter that I can add poles to, but this is a litter, and it can carry up to about 700 pounds of human beings, as well as you can almost put 2 on there, really, but you don't want to do that. Typically 1. But I have 1 litter, and on my litter, I have 1 attached whistle. This just gives me signaling opportunities for someone coming in from a medevac. But a litter is very, very important to properly move somebody out. Now, the great thing about a lot of survival training, and Jason's showing us right now, is building your own field litters. These are these adaptive sort of litters that you need to create out in the bush, using shirts, using jackets, using 550 cord and cut trees and all sorts of things. But a litter is very, very important to move a patient out of an area, because you might have to bring them to some sort of link up point or LZ, or there could be incoming weather. Regardless, is if you have to move a patient, you want to use some sort of litter form. Keeps them stable, keep that head stabilized, keeps that spine nice and straight for the most part where it needs to be, and you can avoid any other injury. So whether it's a field litter or a actual litter, this is a great thing that I have, and I must always have it. Another thing that I have is a neck brace. This is a adjustable neck brace based on the injury or whatever that issue could be. This is something that I can use to stabilize the head, keep the neck where it needs to be. This is an adjustable one, and it's kind of a one-time use. Once I start folding it and manipulating it to that person's specific neck based off their size and their height, you could use it again for somebody in that size, but not so much for a smaller patient. But yeah, this is essential gear. If somebody does fall, let's just say for the last movie that I was working on, there was some cliff work. Some of the actors were hanging around cliffs. For me, also as the set medic and then safety coordinator, you just kind of, all right, what do the shots look like for that day? We're going to be working around some cliffs. We're going to be kind of doing some remote things. I'm not even going to leave this bag anywhere except for right exactly where I'm at or next to one of the cameras, so on and so forth. But neck brace, extremely, extremely important. Medical scissors, everyone's really familiar with these. It helps cut through pants. The one thing you don't want to do is, if you got to get to a leg that's bleeding, whether it's femoral bleed or just a big, puncture wound, is you don't want to throw out your knife. I mean, if you have to, you have to, but you really want to avoid that and throwing your knife through that pant leg and start ripping up. The blades tip and you can start making extra cuts. You don't really need to. But these medical grade scissors have those protective tips right on the end, and you can just remove the pants as you need to and start to triage the patient. A couple pairs of those. All right. On the inside of this, again, this is kind of more of my sustainment items, but I have a variety of wraps. I have more first aid kits. There's extra Band-Aids, extra Neosporin, a whole bunch of things on the inside of here that will supplement my other packs. What you don't want to do is be out on a set or be out in the field or be teaching some classes and you start running out of material. So all these things are designed to support my primary case, and I have everything in here from this is a electronic heart rate monitor. I have eye patches, just really everything and anything that kind of I'm not determining is going to greatly impact that pattern of life for that day, but it could be something to consider as well. More tapes, rubber bands, ace bandages, you name it, it's going to wind up going in here.
Can you hear me, Donny?
People, yeah, I got
Can
you.
Can you go over tourniquets once you hit them? Can you go over them a little bit more?
Yeah, for sure. And then even in here, since this is my sustainment one, I have some, natural salves based off the environment. I have some tea and electrolyte packets, just more bandages, different sort of ointments. Some people are not very comfortable putting, kind of modern day medicines on their skin. So they want something a little bit more holistic, a little bit more natural. So just try to provide those options as well. A whole slew of Band-Aids. And, I can't tell you, there's probably been many days I was supposed to make some YouTube videos on these, but I have yet to do it. Here's some wound dressing gel, more electrolytes, tape measurers, just really everything and anything. Some ponchos, emergency blankets. These are just those extra items that I'm going to wind up using in the event of an emergency. If I got to triage somebody and get them off the X. Now, it's important with all of your kits, one, you know how they work, you know where they function, and you re-inspect them every time. So if I'm getting ready to roll out of the backcountry or teach a tracking class or whatever, I go through my kit, make sure I know where everything is once more. I update it, If anything's low, I resupply it and I go through it. The important thing for me is I don't use anything in these bags or these kits at my house. That's where I use my just in-home basic first aid kit for minor cuts, burns, scrapes, things to that extent. And anything that deals with taking, the heart rate of a patient or kind of really mending any sort of major wounds, I go ahead and you just keep those separate. I don't try to mix them. Now in my car, I essentially have a small brown bag, very similar to this, and it's just full of Band-Aids and topical ointments. It's just something I keep in my center console. And it's kind of ironic. Today, my boys and I, we went rock climbing. We did some bouldering. One of them got a scrape on the knee. I handed him the bag. He applied what he needed to apply, and there were no issues after that. So medical bags are based on those situations, based on those environments. My two major bags, movie sets, backcountry work, maybe large events, things to that nature. In-home first aid kit, that's for my house, very applicable to my pattern of life here as well as my two sons. And then even in my car, just a small little bag that I'm going to be using on the norm. Now, if I am going on a long trip, like tomorrow, my boys and I, we're going to go out and we're going to swim in a couple rivers and we're going to do some exploring. I'm going to bring my red bag with me. It's just in the event of, just like when I saw that lady, she rolled her car a couple times and the front was smashed out. She was able to get out. I had my red bag just in the event of. And one of the most important things I always carry on that red bag is a tourniquet. And tourniquets, there's a lot of different types of tourniquets out there. I definitely recommend everybody knows how to make a field expedient tourniquet with some sort of cordage or a belt, and then a hardened bar that you can twist into it and stop the bleeding. But most tourniquets, these are pretty popular. I think Jason's going to provide a link that you guys can all take a gander at these tourniquets. But the idea behind a tourniquet essentially is to stop bleeding. One of the major issues that we faced in the Iraq war and even in the war in Afghanistan was there's a lot of major trauma from ID explosions, guys getting shot up in multiple portions of their body. And it wasn't necessarily, yes, the wounds had a great deal to do with it, but it was the bleed out. Guys were bleeding out too fast and applying, if this is the appendage that's missing, me applying pressure here is not going to stop the blood. I need to get up into the inside of the arm and stop the blood from running out. So there's a large problem with bleed outs. And before you know it, there wasn't a Marine, a soldier, a sailor, airman that wasn't carrying some aspect of a tourniquet. And a lot of these cats are probably the best things because they're very just kind of point and play based off where that injury is, where that blood is. Now, this is some sort of arterial bleeding. And how we know it's arterial bleeding, there's a pulse. As your heart beats, it's pushing that blood, and you're going to see that blood kind of squirting out, and as it slowly oozing out. And as it oozes out, you're losing a lot of blood, and you need to apply that tourniquet. And the easiest way is you want to go above where that wound is. Now, this is hard for people because if it's a leg wound, you have some sort of femoral bleed, and it's above the knee, you have to get way high up close to the crotch to stop that bleeding. Same thing if the wound is closer down by the foot, someone rips their foot off or they snap their Achilles and they got a major bleed out coming that way. That's a tricky one because your Achilles is going to shoot up into your backside anyway, but you could have a major bleed out in conjunction with Achilles. That could be a whole world of nightmares, but I would still apply a tourniquet on there. But the idea is to get it way above the wound. So if I have a major bleed out in this region, I'm losing a lot of blood, I'm going to apply my tourniquet. And here's the other thing. Don't use your tourniquet. You want to practice with your tourniquet, but you never want to wrench it down all the way. Like this is for extreme situations, but you apply that tourniquet and it's covered in Velcro. And you're going to connect the Velcro all the way across. Okay. And on your tourniquet, there is a bar. And this bar is going to be your bar that you can start to rotate and cinch. And what this is going to do, it's going to start to lock down all of your veins, all of your arteries on the inside of that arm, and it's going to prevent the bleed out from occurring. Once you're rotating your bar, you have these two little C-clamps right here. That's where you're going to lock your bar in so it doesn't pop out.
As soon as you start spinning that thing too, it sucks. I mean, they hurt.
Oh yeah, that's why you don't want to do it to yourself because you have to wrench it down. You're watching the blood come out. You wrench it down until it stops. And there's been countless times where you'll see people just losing it because of the pain, not so much from the wound. So you got to be really careful if you're packing this. You don't want to cut off your own blood supply. But once it's in there, you're going to take this bar and you're going to put it in between these C-clamps and take this Velcro tab so it doesn't pop out. And what's going to happen is you can reclose, get a secondary squeeze on that, and now you've stopped that bleeding. And then from here, you're going to mark your patient. At what time you got the bleeding to stop. You can put the time on the overall forehead, their blood type. There's different variations on how you inform a responder to this tourniquet. But the one thing you have to do is considering letting the limb live, right? And that's where you loosen the tourniquet and let a little bit of the blood flow so the remainder of that flesh doesn't start to rot out and lose life for the most part. But if you're at that point where a complete arm is missing, you don't want to let any of that blood out. You really just want to save it. We're talking about if you have more of an injury where you're going to have some problems in the long run by you cutting off too much of that blood or any sort of, opportunities for those muscles, those tendons to have some of that blood on the inside. If it's a superficial wound, I mean like a deep laceration, you're having trouble stopping it, you just got to be careful. Complete removal of the appendage, crank away. The last thing you're worrying about is them being comfortable or losing any of the little bits and pieces that could be hanging off. But yeah, I definitely recommend tourniquets. Throw them in your cars. That's where you're going to see, as a civilian, as other guides and instructors and just outdoor enthusiasts, you will come across people that have been in accidents and they have a deep, laceration somewhere on their body and they're bleeding. I think last time we talked, myself and there's a nurse that came in and we held this lady. We basically kept her alive. Her forehead was sliding down her face. My folks were actually in town. It was kind of a crazy story, but it was right off 25 in Academy. She was holding onto her steering wheel. She hit another car. Both of her wrists snapped. So she had 2 noodles and she had a deep femoral bleed. And it was probably maybe about 3 inches above her knee. So, I went up there. I did what I had. I didn't have a tourniquet on me, but I had my belt. And I took off my belt, cinched it tight as I could on her leg, and then grabbed a piece of metal that was there and just started twisting and twisting. And I was able to twist it, and I was able to hold it and then tie it off with the back end of the belt. And my main focus at that point was talking to her and watching that leg and making sure that tourniquet didn't slip and there was no blood coming out. And then at probably about 30 seconds into that, a nurse came over and she was talking to her from the other side, and this lady's forehead was just sliding down because it was a sheer slice right across where she broke her wrist and then hit the steering wheel, and then it was just chaos everywhere. But it probably took about, I'd say, 7 or 8 minutes for paramedics to show up, and that's what we did. We just sat there, talked to her, kept her going, checked her bleed outs, checked all of her wound stuff, and kind of away we went. But it's important stuff. It really
7 or 8 minutes without you stopping that blood flow. By the time the paramedics got there, she'd have been gone.
Yeah. Well, it's funny. I have a blog coming out probably in the next day or two about the survival rules of 3. And, there's all the different rules. And I'm kind of a rule breaker. I don't necessarily believe them, but there's some things that apply in different forms. And one of them is, bleed outs. And it's kind of like that 3 minutes of a bleed out, that person's dead. Your body doesn't hold that much blood. So stopping the bleed out before that 3-minute mark hits is definitely important. However, though, that's just with one wound. If you've ever seen just complete chaos and major trauma, you could have multiple wounds and that bleed out could be in like 12 seconds. So case by case, really.
That blog is coming out on the Cave blog?
Yeah, it's going to be out on the Cave blog.
I've dropped a link into the
cool.
comments here. So if anybody wants to check it out.
Right on. Yeah, it's a good one. It's kind of like, it doesn't challenge the rules. It just says that, there's different ideas. I would like to think of the rules of 3 really as more as kind of like, kind of just guidelines, things to consider in certain environments, but there's no hard rule saying. I know paramedics, my uncle was a paramedic for years, and God only knows the sort of stuff that he's seen, but, you could wind up pulling a baby that's floating in the bottom of a pool 15 minutes later and resuscitate him. And I guess the 3 minutes of no air kind of broke that one. But I say the rules are really based on mindset and psychology. And I think that'll probably be another, long conversation for us to have in a future Fridays. About
it's more like it's more of a guidelines of 3, but I want to say something real quick about tourniquets. So Donnie, you had the cat tourniquet here. Yep. Beware of the knockoffs. This bar or whatever, those tend to break on the knockoffs. Make sure you're buying these from a reputable source. They're going to cost you anywhere between $20 and probably $40, depending on who you buy them from. I did drop some links in the chat in case you're interested in. But another tourniquet that came out a while ago, I just want to show this to you. I can't pull it up here, but there's these rat tourniquets. I don't know if they're still out or not, but I don't think these guys are very great because they're very narrow. They're probably about as narrow as my pinky. And really with a tourniquet, the wider the better. Narrow tourniquet is going to cause a lot of tissue damage right where it's at, or muscle damage. And the idea behind these wider tourniquets is it causes less damage. Another tourniquet I'll have here, let me flip back to this main screen. I do also have a SWAT tourniquet. You can see how wide this guy is compared to the regular cat tourniquet. There's nothing wrong with the cat tourniquet. They're just different styles. Basically, this is a big rubber tube. You can, if you're a bicyclist, somebody who goes down, you can pull out that inner tube out of their bicycle and use that bicycle inner tube as a tourniquet. But for this guy, it's got these instructions on it. Let's see if I can show you here. So when you pull this down on somebody, you're putting it on their arms, it's going to stretch. I'm trying to figure out which way to go, but you're going to stretch this tight enough to where that oval turns into a circle, and that's how tight it's got to be. You see
very cool
how there's an oval there, so that way you know that you've actually got it tight enough on that person. It also has some diamonds on it. Or it's got squares. You're gonna pull it until those squares turn into diamonds. So that's how you know that this SWAT tourniquet, and you see how long this thing is, so you can wrap it around their arms several times, or their legs, or it's great for a large person or a small person. So that's just a different option. This is what I carry along with my cat tourniquet. I have different options, but that rat tourniquet I think is just too narrow. And also those medical tourniquets that if you go in to give blood, let me see if I can pull one up here. Those are not the proper tourniquets, though. Yeah, don't use those as your life-saving thing. I can't. It's not letting me pull that up. Maybe it will here.
Those are just like to get the veins to bulge.
Right. That's not a tourniquet. I mean, they call them tourniquets, I think, when you're in the blood draw place or whatever to get your blood tested. But those are not tourniquets that you're going to take and put them in your med kit.
Yeah. Some of the things to think about when you're applying that tourniquet is that if there is a major, let's say, an appendage is removed, is veins and arteries and the things that are, allowing the blood to escape don't always stay in place. So the wider tourniquets are going to give you a little bit more coverage. That's why you got to really seat those tourniquets deep up into, underneath an armpit if it's a lower extremity, or above the elbow if it's a hand. These sort of things, your veins and things move. So you got to make sure you're actually clamping down on those veins and those arteries while you're applying that tourniquet. So let's see.
Just a comment about the
tourniquet. Oh yeah, it's Kristen. Hey, what's up? Cool, right on.
Yeah, cat tourniquets, SWAT tourniquets, great thing. There is the TCCC tourniquets that are out now.
Yeah, traumatic combat casualty care. Yeah,
right. Yeah, and they have a ratchet. I've seen them. I've not used them, but they're supposed to be really great, and they're a little bit wider than the cat tourniquet. I'm going to get one eventually, but there is actually a belt that's that TCCC tourniquet, so you can wear a tourniquet as your belt, which I think is a fantastic idea.
I know. I think Wazoo Survival Gear needs to get going on a tourniquet belt.
Yeah,
a cash belt.
You're right.
I don't know if Dustin's listening, but now would be or Mark. Now's the time.
Right.
Get the tourniquet belt going.
Absolutely. All right. I think that's it for the tourniquets that I know of. Yeah, just stay away from those rat tourniquets. They're too narrow. I think the SWAT tourniquet, the cat tourniquet, and the TCCC tourniquet are the ways to go now.
Right on. Yeah, I can tell you, having a good working knowledge of medical skills, not even a full blown, you don't have to be a paramedic or anything, but knowing some at home triage. And if you're, find yourself out in the backcountry a lot, knowing some of those remote triages are pretty important. Some of those life-saving skills, even simple as CPR, understanding what happens if someone gets hit by lightning or drowning patients, this, that, and the other. So you can never go wrong learning medical. Now, I know that's hard for some folks, but there are a lot of resources out there, everything from your local Red Cross to your YMCAs that offer simple classes like CPR, infant, child, and adult, AED. You can get all. And I recommend everyone reaching out to those sort of resources and start kind of exploring them, as well as just some at-home readings. There's a lot of books out there that talk about best medical practices. You should do this, you should do that. And I want to say, you gotta take them. You gotta take them with a grain of salt, because they're painting a scenario for that sort of outcome, if you will. And what that can do is kind of be a little bit misrepresenting at times, but it can be a little bit kind of a balance between. Not every situation will be the exact same. How you treat a patient will not be the exact same every single time. So for me, if I'm working on a movie set, I actually have a licensed medical doctor that is my reach back. I can call him, I can call her and say, here's the information I have. I have a patient has X, Y, and Z. What is your recommendation? If it's something that is not trauma related, like a broken leg or, some sort of incision or cut. So even in my own world, with all of the experience that I've learned over the years, I still rely on a licensed medical doctor to reach out to and say, what is your recommendation? And I like to use this as my perfect example. Without providing a lot of names, the last movie, there was one of the actresses, she was pregnant with twins, and we were working in 110, 100-degree heat to 115-degree heat. And for me, having to deal with one of the actresses who was pregnant, especially with twins, and she was ready to give birth within, I believe it was like a month and a half to 2 months, that brought on a whole new set of concerns and things that I needed to address. So, I don't typically handle pregnant women in that capacity. They don't join me on excursions into the backcountry. So this was a first for me, but this is why I have that resource on the backside, is to call this doctor and say, let me tell you about this patient. Here's her current stats. These are her vitals. These are the medications she's on. These are my most likely, events to happen out here. It could be heat exhaustion, a snake bite, any sort of minor, sunburn. Let's talk about treatments. Let's talk about what are my best approaches to handling this particular patient. So, that's important to do. It's kind of, I like to say, you can't deceive yourself in your own abilities and say, all right, I know I have certain knowledge, skills, and abilities in this field, but I also need to reach out to a professional and say, what's your take on this? Honestly, give me the low down and dirty, and, help me out on this. With that, I was also dealing with a lot of younger kids from the age of 12 down to about 7 years old, and how you triage a child is way different compared to how you would triage an adult. There was a couple times where we had a couple heat incidents where some of the kids were, they were hydrating, but it's a lot harder. A child's body works a lot different compared to an adult's body. They don't sweat as much. So you have to pay attention to it. Now a child and their kind of normal pattern of life is how they respond to heat, hydration, the food intake. There's a lot of these things you have to factor in. So again, I reached out to the standby doctor that I had on through remote communications, and said, these are my, there's 4 children working on this particular movie, and we had to address all of those things. And that just really comes with kind of time and practice. And it kind of goes into the same thing. And I know Jason does the exact same thing. As we bring clients out into the backcountry or even around a static camp, you still have to know their medical information. Is anybody allergic to anything? Has anybody had any major surgeries in the past, week to 30 days? These are all important things that we need to know. So in the event of something, we know how to kind of properly triage that event, as well as make sure that that patient is taken care of properly. More importantly, when it comes to triaging that patient, if we go to some sort of medical services, we know a little bit about that medical history of that patient. So many of the folks I bring out, they fill out a medical questionnaire. Jason does the exact same thing. And you just make sure that you do that. So if you have to stop, and in the event of that movie, I interviewed every single one of those people to find out what medications they were on. Do they have enough medications for this 45-day shoot? Do they have any sort of concerns or allergies? And guess one of the biggest things that I asked them was, and this blew my mind, but I know a few of them were probably watching, but I would ask them, what's your blood type? And I would say there was about 10% that actually knew their blood type. They're like, why is that important? I say, what happens if you needed blood? How are we going to make sure that we got the right blood for you? Because if a Flight for Life comes out, they're coming out with blood, and they're going to administer that blood as they're coming up, and then they're flying you out to a medical facility. And if we can't give you blood because you've lost a lot of it and we were able to stop it, but we need more, that's something we need to know. We also need to know, again, I'm not sure if I'm allergic to something. Well, and I got that. A lot of people don't know they're allergic to bee stings until they're stung by a bee and their throat closes and their tongue swells. But it's important to know who your clients are, who your patients are in advance, so you can kind of prep your kits to kind of reflect what possible things could go wrong. And that's important. There was one patient that was a diabetic on this last shoot. That was a huge concern. There was one gal during the entire shoot. She had bursitis on all of her joints, which is a swelling of the joints, which made it hard to work. There was different people that had different ailments, and it's important to just know how to treat them. And like I said, reach out to somebody that is a doctor and say, what do you recommend? How do we go about approaching this? And the doctor that I was working with, we have an agreement, a partnership within this, saying that as I apply certain services or I give certain services and a production sort of elements, for me, insurance-wise, I like to have a licensed medical physician remotely that I can call in the event of, it even goes down to administering, medications. When it comes to doing epinephrine or morphine or adrenaline or anything like that, I know how to do those things, but, it's important to have those conversations with that medical professional right up front. So, yeah, there's a lot that goes into. I could talk for hours about setting up an entire medical protocol for a movie set, as well as bringing 5 clients into backcountry and making sure that, yes, I see 3 that I would presume to be very healthy ones, and then the other 2 I'm highly concerned with because they're having trouble breathing. They're showing signs of dehydration early. And then all of a sudden, your survival training turns into a real survival scenario where you have to address the needs of those people right up front. And out here in Colorado, we battle a whole different world compared to some of these different environments. We have to fight the elevation. We have to fight the weather. We're getting 3 days of snow starting Sunday. So, everyone else is enjoying their mushroom foraging and their springtime this and their springtime that. We have to get shovels out and start shoveling again. But so you have to really just make sure that you can take care of those patients or those people when they come out to Colorado. Every breath you take at 8,000 feet, you're losing moisture. The sun is so much more intense. This is a very difficult environment. So you just kind of have to be prepared for that and make sure that you can address all of those needs. Jason, what are the majority of the people that you're dealing with? What are some of the major problems, or just kind of the top 3 problems that you come across with the people you're teaching?
Number one is going to be altitude sickness, just like you were saying. Most people, at least for the first 2 days that they're up at camp with me, they're exhausted, and they wear down fast, breathing heavily, moving slow, and that's all low elevation altitude sickness or basic altitude sickness. It's not severe yet, but yeah, that's the first signs, is that fatigue. The next thing, probably dehydration, people just not drinking enough water. And then outside of that, I don't know, since we're doing a lot of knife work, I always get people that cut themselves, but common everyday, or should I say environmental things. I guess we also have to worry a lot about lightning. Lightning is a big thing, but that, when storms roll in, you just get the hell off the top of the hill and find some place and disperse a little bit. But yeah, altitude sickness is by far, hands down, the biggest thing I run into all the time when we're up there.
Yeah, I agree. 100%. Altitude sickness, dehydration. And then I think sometimes it's just kind of their overall personal care, those things start to impact their other care, like
Right.
how they want to go about eating. Once you start getting altitude sickness, you're like, I don't want to drink anything because you're dry heaving, and you're not to the point where you're having like pulmonary edema and your lungs are getting filled with fluids, but like it starts to impact everything else. And I can tell you, sometimes it's better just to start at those lower elevations and slowly creep to 500 feet and then another 500 feet, because that will seriously put some people down. And in those minor cases, the only thing you can do, come down in lower elevation.
Right.
Really give them some of that oxygen, the boosts.
And if you're like me, I mean, I get a lot of people that come up from out of state. I've had people fly in from sea level, and then they head up to the 9,500 feet with me, which is right at, well, you're still I think altitude sickness usually starts hitting people about 6,000 feet, which is Colorado Springs elevation. They're coming up another 3,000 feet, and they're hitting mild symptoms of altitude sickness. It's not until like 11,000 feet that most people usually have more of an issue, but still you can still have HAPE at 9,000 feet. So I really watch people, especially when I know that they're coming from lower elevations.
Yeah. It's always funny because they always seem to sleep really good right around like 9,000 feet. They're like, I haven't slept like this. And it's like, well, it's because you don't have any oxygen going to your brain. You're slowly kind of shutting everything down. But whatever works for you. Yeah, I sleep great out there. Yeah, I bet you do. I bet you do. So,
but you were talking about assessing all the people before they come in. You have I have a waiver that I have people fill out. If you're doing stuff like that me and Donnie do, if you're guides, not everybody's going to be comfortable about talking about their medical issues with other people, especially other people around. They might feel more comfortable one-on-one. So my waiver is I have everybody write down independently what their issues would be. Nobody else can view that. That's all private information. I'm not allowed to share it with anybody, really, according to the HIPAA violations. I don't know if I have to follow HIPAA violations or HIPAA laws, but as a first responder, I'm assuming that I do. But I don't share that information. Then I always tell my students, if there's anything on here that you don't want to write down and you want to discuss with me, pull me aside later and we can talk about it. That way, I know if you do go down, I can know what's wrong with you. And I always skim through people's waivers to make sure that if they did write something down, I see it. I don't just grab that waiver and throw it in a pile somewhere. Make sure you're checking the people's conditions, their previous medical conditions. Don't be scared to ask people. And if you are a first responder and you come across a patient, don't just treat that wound. You're treating the patient. So you're if they're conscious, you need to be asking questions while you're working on a major bleed or anything like that. Check their whole body, check their mental capacity, make sure they're talking to you, and find out their medical history. When I say that, find out pertinent medical history, so you don't care about.
I was 12 out of 2.
Right. So if they start going down these rabbit holes of little things that have nothing to do with the current situation, you can stop them and tell them, no, I want to know things that might deal with what's going on right now.
Yeah, do the same. Good medical questionnaire, pre-screening, and then a post-screening once we kind of get on site objective. Hey, anything's changed, any new updates, anything I just need to be brought aware of. Do it one-on-ones. And I think, one of the important things is kind of like medications for folks. If like they take medications and these sort of things, is making sure they have those proper medications and then the supplementals to those. And, if somebody has to take a pill every day, I'm totally for it. Like, hey, whatever you got to take, you bring it with us. I know it's a primitive skills class, but we're not doing like medicinal heart medicine. Okay, so
that's something you brought up earlier about the EpiPens. As a first responder, I don't know what your training level is at, but I know as a first responder, I cannot administer an EpiPen to somebody. I can help them administer it to themselves. But for me to do it myself, I'm breaking protocol. If something bad happens, I could, be sued or fined or go to jail for it. But if they tell me where it's at, and I can actually even hold their hand and help them do it, I just can't do it myself. So be aware of that. If I have an EpiPen that belongs to me, I cannot give it to somebody else. I can't use it on somebody else. I have to use somebody else, that person's own EpiPen on them. So be aware, you can't administer your drugs legally to somebody else.
Yeah, because EpiPens are a prescription. You can't get those over the counter.
Right.
So if it's any prescription, in that case, yeah, it's only used for that person. My stuff, since it is adrenaline base 0.03 mils, I can administer it.
Is that something that you got through your doctor, your director?
Yeah, so I mean, you can come across it in a couple of various ways, but through that sort of mechanism, as far as the delivery, as far as the syringe, as well as the pop tops, as far as the adrenaline, yeah, you can request it if you're trying to build out a medical bag. But I get it from various doctors and just say, this is what I need, this is what I have. Why though is because this is exactly what I'm going to have. I'm going to an area where there's a lot of stingers, there's a lot of biters, there's a lot of things that I need to make sure. And the issue is, this is the issue with EpiPens. Not everybody has been stung by a bee to know they're allergic. So for me, you can sue me all you want. I'd rather administer you, make sure that you stay alive, and then we can go, go that route.
Something you can bring with you is Benadryl. It's not as fast acting as EpiPens, but
Benadryl is great for small swelling. I mean, this is like
if somebody's throat is swelling up and they can't breathe, absolutely. But if it's mild things, you can use that Benadryl. Something else I want to talk. I don't know if you brought it up or not, but I also bring sugar packets or cake frosting or honey with me for diabetics. If I come across somebody that's acting weird on the trail, not acting, if somebody's passed out, you're not supposed to administer anything to them. You're not supposed to put anything in their mouth. Yeah, but I mean, a little bit of cake frosting or sugar on your finger with somebody's being weird. You don't have to stick your finger in their mouth beyond their teeth, but you can rub it on their gums, and that could help somebody come out of a coma, a diabetic coma, or whatever, seizures or whatever they're having. But go ahead with your stories. Stories are better than me talking.
That might be I shouldn't share this one.
No, it's a bad one, huh?
Yeah. No, it's not bad. I didn't do anything wrong, but there was an unconscious person, and my friend was telling me they went up and they started to check him out, but it was more like kicking him, and kind of the guy was I think they knew him, or they knew there was a party going on like farther in the mountains, and guy basically passed out from too much alcohol. So it was more like, hey, wake up, wake up, wake up. And then there was like sticks, and then, they started writing off. Like, don't tell me these things. There's a lot more to it, but I'll leave it at that. But
that's something else that people need to know. A lot of people aren't aware of. If you're coming from a lower elevation up into a higher elevation, alcohol is going to kick your butt. If you're a 6-person a day beer drinker or whatever, knock that down to 2 beers, maybe 1 beer when you first come up here, because you are going to get drunk way faster than you think you are. And I see that. I mean, I don't allow a lot of drinking at my camp. I let people at the end of the day have a beer or 2, but keep that partying to a minimum, at least until your body acclimates to this elevation. Because man, I see people going down all the time because they just drank too much, but they're used to drinking that much at a lower elevation.
Yeah. Smoking is also important. And I feel like smoking has really faded out over the years, these past 15 years, but every once in a while you find those people that smoke, or they do the USB vape things. I mean, all that stuff is going to impact you once you get up in the upper elevation. So yeah, I mean, they're all.
You want to talk about sternum rub, since Kirsten brought it up? I'm sorry.
No, go for it, man. Go for it.
It's all you, buddy.
Let's think. So what specifically within a sternum rub as far as administering?
Probably for an unconscious patient.
So I've never really done a sternum rub on an unconscious patient as far as trying to get them to recall, as far as waking up and things of that capacity. Anytime I come across, or if I was to come across a patient, number one thing is you're going to check for what's called a priapism. And that is, it's really stemming into a back injury, which is going to give the person, if it's a male, an erection, and all that blood flow is going to go to their penis, and they're going to have a huge erection. But that is also indicative of a back injury. So in a female's kind of context, if you come across someone that is unconscious in that way, there's certain things you have to check for, but they will have a tightening of the lower extremities where they won't be able to bend their knees, and they'll have a tightening in and around the upper kind of quads for the most part. But as far as coming across unconscious patients, usually you want to start off with some sort of verbal or voice kind of identifier command, try and get them to recognize you, you to recognize them, and start to immediately kind of assess that situation. For example, with this gal this past weekend, fortunately, yeah, it's nice. Of course, it's nicer than kicking, but it's definitely like with this gal that I came across this weekend, she was physically coming out of her car, but as I was crossing the road, I was giving her those voice commands saying, "Are you okay? Is everything all right? Tell me what happened. Where are you from?" Because I'm just testing her knowledge right up front, kind of, is she coherent? Is she functioning? Does she know that she's gotten into, an accident? And what is her kind of awareness of this? But the great thing was she was not injured. And, there was a certain point where we kind of walked around the car. I said, let's get your things out of the car. We're going to drive into the next town where we can get some reception. And as she was doing this, she was explaining a lot of things. She told me her story. So she was definitely there. She had some minor bruising across, but there was no need to really just really give her a ride. But unconscious patients, you just kind of have to approach it just like anything. Some people could be unconscious where they're conscious, where a scare will jolt them into some sort of reactionary thing, and they could injure themselves even more. As far as finding them, the old Marine Corps trick is you grab them by the toe. You grab them by the toe and you start to squeeze their toe, and then you slowly work their way up in the event of you're offset. You're not over the top of them, because people can respond in negative ways if they have something in their hand, but you grab them by the toe, squeeze their toe, start to move their toe, squeeze their ankle, and that slow pressure from the toe up to the calf, up to essentially the side going to the sternum. You should get some sort of response after you've done a verbal sort of thing. But case by case, it really is going to be case by case. I can't think of a time aside from maybe a handful of, accidents dealing with people here and there where I've come across a lot of unconscious patients. I think just, Iraq and stuff like that in different capacities, but someone's unconscious. I don't know. Like there's the theory of shock. I don't know if everyone's ever heard of this, where if somebody's going into shock, it's actually the natural way for the body to respond to prioritizing blood to, the heart, liver, lungs, and the brain function by eliminating the extremities and kind of putting the body in kind of a pre kind of coma state where it's just prioritizing these things. And we've made an error in the past when people would go into shock by trying to bring them out of shock. And whether it was shock from some sort of major wound, forcing the bleed out, because that's kind of what you're causing, is everything to kind of kickstart back up and start bleeding again. But I tried to do some research into it, because there was a bit of medical training I got to experience where there was pigs, and you would take the pigs, and they would stab them, they would shoot them, because a pig's anatomy is very similar to us, and they would kind of go into the shock state, and then as we would resuscitate them, X, Y, and Z would happen, and they would bleed out, or there'd be other sort of injuries that were kind of coming from that. But the idea is to keep the person actually in shock for a period of time to let their body kind of recover. So I don't know how authentic that is. I don't know. Maybe somebody else has heard something like that. I'm not really sure, but that's the whole shock sort of scenario.
Yeah, I've never heard that there was ever a problem with just treating somebody for shock, even if they don't have shock when you come onto a scene. But yeah, I don't know.
Right on. Yeah.
You got anything else, Donnie?
No, that was kind of it for those kits. I think I just really recommend that people really practice doing some home triage, especially with the coronavirus and all the stuff that's going on right now. The things that are going to get you exposure, in my personal assessment, are the hospitals. That's where people who have signs and symptoms are going. So if you can avoid going to a hospital and you can treat some minor wounds and some minor illness and injuries at home, you're just going to eliminate your kids or your exposure to a potentially harmful virus. So if you got to learn how to throw a stitch into someone's forehead or stop kind of a severe bleeding and kind of do some triage in a certain way, that's really going to benefit you not only now, but well into the future. Saves money, builds in your own self-reliance, your at-home self-reliance, as well as it kind of segues into your wilderness self-reliance. And they're just really important life skills, you know.
I know somebody's probably itching to ask the question, but what I'll do it for them. What's your belief on stitches in the backcountry?
I don't know. I guess if I'm looking to apply a stitch, I can, and I got the necessary stuff, I'll do it. If I got the right solutions to clean and sterilize the overall environment that I'm doing. But I got to make sure, you know, you irrigate the wound. There's a lot of things that would ultimately make me say, yes, I would apply a stitch here, or no, let's stop the bleeding, let's protect the wound, and then let's try and triage. But I don't know, case by case. I mean, you could go to a field medic out in any war zone, and they'll apply stitches.
Yeah,
I've seen Navy corpsmen in the middle of Iraq. Some dude's walking, you know, to the head or to the latrine in the middle of the night, trips, cuts his forehead on concertina wire, and a corpsman stitches him up, gives him 3 stitches, and he's good to go. So,
yeah. Well, that's probably a slightly different situation because, you know, that corpsman is probably the closest medical expert around. Whereas, you know, if you're in the backcountry, there's good potential that you can get to definitive medical care within a reasonable amount of time. But I think you hit the nail on the head with make sure that you can sanitize or clean the best you can so there's no other bacteria or anything that could get into that wound. Because last thing you want to do is stitch up a wound and have bacteria inside that wound, and also have a dirty needle, dirty thread, or whatever. You're just introducing more harm to the body, you know. So
and I think most people would agree. You want to bleed. You actually want to bleed a little bit to kind of, that helps flush out some of that stuff. Overexposure, overbleeding, and, you know, openness to the environments will definitely cause some problems, but bleeding's a good thing initially. You can also see from the bleed what sort of obstructions things could be flowing out, discoloration. You can see for any sort of, if you hit like a fat layer, the fat cell, you can see fat cells coming out. I mean, I remember slicing my foot open being like, what the heck is this? You know? So yeah, I mean, me personally with my kit, I feel completely confident I could create that environment. Why a stitch to the hand, creating that kind of that micro environment around the hand through various plastics and sort of protective measures, my own gloves, cleansing fluids, irrigation fluids, preventative, you know, bacteria, this to stitching up a patient. But if I got to give somebody 15 stitches, I'm probably like, we're at a serious point where stitches isn't really my main concern. Onesies and twosies, you know, case by case.
Yeah. So you brought it up. I'm not sure if you brought it up while you were talking, but everybody, if you're going to be carrying your IFAC, your individual first aid kit, make sure you have gloves. At least 1 pair of gloves, if not 2 or 3. A CPR face shield is really need to have that. That's obviously to protect you, not so much the patient. But there's, mine are kind of, these ones are just kind of loose in there. I need to actually pack those into a more sanitary little bag, but just something else good or you really need to have is your PPE for you.
Yeah, that's a big thing in the woofer classes and wilderness first aid is, you know, making sure you're safe from any sort of bodily fluids, any sort of other hazards. I mean, that's a huge portion. I know
you're the number one.
Your woofer class.
When is it? Actually, I pulled it up right here. So, I'll show you 2 different things here. So I've got the wilderness first aid class. This is being taught by Mark DeJong, off-grid medic. I'm not sure if it's DeJong or DeYoung. I'm sorry, Mark. But yeah, July 18th and 19th of this year is the 2-day wilderness first aid. And if you,
everyone should have that. I'm going to be 100% honest. I believe Woofer is really great for people like Jason and I, and, you know, a variety of other people that find themselves routinely in those environments. But a wilderness first aid class is probably the best class for basic first aid in conjunction with bush time. You cannot beat that. That is a great class.
And that does come with a CPR cert if you want it. It's kind of an add-on additional thing for the CPR certification. So I mean, it's a 2-day class. It's the basic first aid, really great thing to have. I think it's a step above regular first aid training. There's wilderness first aid and first aid training. The reason why I think it's better is because wilderness first aid helps you or teaches you how to improvise when you don't have the stuff. You don't have your med kit or an ambulance or anything like that. But yeah, July 18th and 19th. Let me actually throw this out here in the chat.
Everyone should sign up for that. I mean, I can't tell you.
If you're looking to get a little bit more in depth, the WFR, or the Wilderness First Responder, is July 20th through the 26th. That's a 7-day program. We did try to do that in a 5-day condensed version, and it's like drinking water through a fire hose. There's just too much information. So we spread it out. We do day and night scenarios on that. And then you're WFR certified when you're done. And that comes with a CPR certification also. So that's, again, July 20th through the 26th this year. You coming out for that, Donnie?
I think I might. I think mine's up this year. I have to look.
Well, I get the benefit of, since I host that program, I get the benefit of getting it every year. So it's kind of a bonus.
Noted.
School.
But I can tell you this. Here's another great reason why the woofers thing. That's kind of one of the requirements on some of these. If you want to get into TV and kind of film working as a set medic or an actual medic, that's kind of one of the core requirements a lot of these places need you to have, because what the whole idea behind that is that you are at least 1 hour away from major medical services, and you know what to do to triage a patient until you get to those medical services. So some of the TV shows that I've dealt with and been on in various movies, a lot of the safety people, they're all woofers. I don't think any one of them would ever be asked to be on it if they weren't a woofer, as well as many of them are just straight paramedics as well. Right. But the woofer is really the key, because again, it goes into improvising some of those, adapt and overcome to the requirements you might need. But they also understand that dynamic of a triage is not jumping into your car, driving 3 minutes down the road to your local emergency room, and kind of going from there. It could be an hour and a half out. So yeah, if you're wanting to get into some of those business opportunities, some of those markets, you definitely got to have a woofer.
Yeah, I think it's a requirement for most guide services or anything outdoor related. You have to have that woofer for them to even consider you for the position. Real quick, Ginger just asked if there's any prereqs for the woofer. There are not. You could come in as a complete beginner. I think the only requirement is you have to be 18 years of age to actually certify. You can take the class depending on who your instructor is, but you can't certify unless you're old enough to receive that certification. The wilderness first aid, though, is a little bit different. Usually they allow younger students to be wilderness first aid certification program. But yeah, no prereqs for a woofer class. Everybody should take at least the wilderness first aid and a CPR class. Yeah. And then if you're really out in the backcountry a lot, or you're looking into guide services or any business related thing, definitely go check out your woofer.
Yeah. And you can start a lot of your knowledge on it online. I know there's a lot of things they offer online for just learning terminology, and like they do a lot of I think in the military we call them TDGs, tactical decision games. So I think they might be called like EMGs, emergency medical games, where you're hiking and you come across a patient who's giving X, Y, and Z sort of signs and symptoms. What do? You know what I mean? And you kind of roll through these different scenarios. So those things exist out there to kind of get yourself up to speed. So when you do take a woofer, you're kind of like already chomping at the bit, understanding how to address this and how to address this. What do I do? Because I've seen Jason's photos. They like to stick the moulage sticks in people's arms and all sorts of stuff.
The training for that.
Movies are ripping it out isn't necessarily the first step, but that's that's important, because how many movies have we seen where they push the arrow through and just there's this gnarliness going on, but
you leave that in there.
Yeah,
and you're supposed to leave it in there.
Stopping the bleeding.
Right.
Why remove it? So there's all these different scenarios that woofer paints, as well as some of these things online. So yeah, start checking them out, getting familiar with them. They'll only make you better. Yeah,
I'm going to drop this out here real quick since we're on it. But check out search and rescue tracker class. It's kind of in line with what we do with wilderness first aid. especially since this is a search and rescue tracking class. If you're trying to find a victim,
Oh yeah.
this will teach you some of the tactics on how to go search for them in the woods. We are running a level 1 tracking class, and that's coming up on May 15th through the 18th. And then immediately after is a level 2 advanced tracking. Can I get to it? Let me go back. But yeah, so if you're interested in tracking, check out our webpage for that tracking class too.
Yeah.
That's all I'll say about that. You have anything else, Donnie?
No, man. Search and rescue brought me back to some times of following footsteps through the Mojave Desert, looking for lost hikers and all sorts of stuff.
You were on SAR for a while, weren't you?
Yeah. Out in San Bernardino, California, all through Joshua Tree National Park, the Mojave, all that sort of area, all San Bernardino County, and we responded countless times to people getting lost. I mean, this is a harsh desert, so you would have a car that's parked and you could see the tracks going off and then they just disappear. But there's a lot of different ways, from shining and all sorts of stuff, where you can find folks. But yeah, and then the other thing that we really did a lot of out there was body recovery and then evidence collection, because there's times, crimes were committed, somebody would do something, they would hide evidence, they would dispose of something out in those deserts, and it went into a whole other aspect of tracking tires, foot mobile, bikes, people on horse. I mean, you name it. It was pretty crazy. And I worked with a really good crew out there that were some straight up desert rats, and we knew that environment like the back of our hand. But yeah, it was a blast. It was a really, really good time. You come across some interesting. Oh man.
So Becca asked real quick, how often do we run that tracking class? I only do it once a year. It is a post-certified class, so that's police officer standard of training. So you do receive a certification from that. My instructor for that is Fernando Moyera. I hope that's how you pronounce his name. Sorry, Fernando. But he's out of Nevada Tactical Tracking School, 4-day class, basic, 4-day class advanced. But again, we only run that once a year. The reason behind it is there's a 12-person minimum for that class. So if I don't hit 12 people, we have to cancel that class. It's part of that post certification. So if you guys are interested in that class, it's a month away. I don't have enough people yet. Sign up for it. Otherwise, I'm canceling it for the year, and then we won't do it again until 2021. All right. Anything else for the first aid there, Donnie?
No, man. I think we kind of covered down on it without going into like.
Yeah, we could spend
craziness.
7 days on this, because that's how long. 7 days is that woofer class. But there's a huge amount of information. There's a lot to read. Go pick yourself up some manuals. I've got that one behind me. You can see I dropped a link for that one. I think Donnie's read that one. Great book. That one's a pretty thick book. Yeah, there's another one. So
Yeah,
get yourself that. I mean, you can only practice so much medical, really, until you're actually in an incident. I've been fortunate enough, should I say fortunately, unfortunately, I've not run into that many scenarios, real life scenarios, where I've had to administer true care. Biggest thing I probably did was a coworker chopped his finger off a few months ago, and I had to help him out. I had a lead that was on the job with me, and then the coworker that chopped his finger off. And fortunately, I'm able to stay calm. That's probably my best ability, is be rational, and I can calm that. I calmed him down. I calmed the boss down. We got him. His bleeding stopped. I treated for shock, and then it got him to the ER where they could put his finger back on, or at least stitch it back up. But the ability to stay calm and help people stay calm is huge. And yeah, you just have to maintain control of your panic and the panic of everybody else that's going on around you. That's the big thing about being a first responder. But yeah, other than that, I just had to do little boo-boos. Sorry, I got a beard hair on my tongue.
Been there. Been there.
But But yeah, woofer, I think having that training actually helps you to remain calm in those situations. And you just have to run through that quickly because you don't have a lot of time to respond in a big accident situation, but you can just start going through that training.
Yeah.
I think that's all I got.
Yeah. Good stuff. Good stuff.
All right. Well, yeah, if anybody has any questions, you guys know how to contact Donny or myself. PaleoTracksSurvival.com for Donny, the Survival University for myself. And if, you can bounce questions off us at any time. Yeah. So Kirsten just put out there volunteering at the local rural fire department is a great way to get training and experience for those folks really interested in learning more and helping the community. Absolutely. When I was younger, in my late teens, early 20s, I actually joined the volunteer fire department in the little town that I grew up in. Nice. Learned a lot of stuff. We did vehicle extractions, cut cars apart. We'd have victims inside. We'd go through, we'd put smoke bombs inside the fire department and crawl through the fire department. They do a lot of cool training if they'll let you in on it, being a volunteer. Yeah, good way to get some extra training.
Great stuff, Kristen.
Yeah. Anything else, Donny?
No, man, I think it was good. It's good stuff.
All right.
Thanks for watching.
Yeah. Thanks for watching. Again, you know where to find us. If you don't, you've been hiding in a cave.
Now we're talking.
All right, Donny, thanks for joining me. Thanks everybody else. We'll see you guys next time.